Hello, Yuvir. We're going to sort of chat about the competition and your entry today. And maybe just to start us off, tell us a little bit more about yourself and where you're from, what you're studying, and where.
My name is Yuvir Naidoo, and I am South African. I grew up in Johannesburg, South Africa. However, I lived in Cape Town for the past 10 years, but I am back now indefinitely. Um, a little bit of background about me is that I am an emerging researcher with interests in health economic, public policy, health financing, and just generally have an interest in the way that economic systems affect household welfare. So yeah, my work is broadly driven by a concern for how policy choices shape real outcomes for people and specifically communities. Then in terms of studying, I'm currently completing my master's in economics at the University of the Western Cape.
In your paper, what was the main research question and the your central answer to that question? Why do you think does that matter?
In my paper, I wanted to understand the what happens economically when healthcare is free in policy, but households still pay in practice. So the central question was just around what are the economic consequences of out-of-pocket payments or burdens in African public health systems where healthcare is officially free or subsidized. And I think why this question mattered was mainly because healthcare healthcare access is not only about whether services do exist. It also asks the question whether people can use those services without being pushed into, financial hardship or, paying out of pocket, as the question poses. And the finding was that just in many African contexts, households still face costs such as medication, transportation, but also diagnostics. So this is where, the central question came about, and these costs affected whether these people seek care or, whether they have to sacrifice something in order for them to get their care. So yeah, I think it links health financing to poverty, equity, and, just welfare in general. Thus also affecting the WHO's universal healthcare coverage in a bit more detail.
Okay, and tell us a little bit more about why you entered the competition and what what your participation meant for you.
I decided to enter the competition because it offers a meaningful platform to contribute to, African health economics debates. There's not a lot of platforms currently that look at health economics specifically. There were many that I saw that looked at, the budget speech or, something of the sort, but never health economics. So it was a good platform. I think this is one of the first ones that actually give the platform. So I definitely wanted to, be a voice in the first sort of researchers that have the voice in this competition. But also just the topic that I chose aligns with what I want to do, or my focus areas and interests for the future. And I saw the competition as an opportunity to think more deeply about an issue that affects many households in the continent, but it's sometimes hidden behind the language of being free. And then just what it meant to me personally. So it meant a great deal to me because I I got the opportunity to use my voice on an issue that affects households. So it is something that affected me personally as well, with my mom having been, sick, and we face out-of-pocket costs. But it's not just my household, but many other households in the continent. So we looked at a countrywide, but then, the same thing affects continent-wide. So it reminded me that, health economics is not only about, models or financing systems, but it is about people's lives. It is about the trade-offs that different households face, and it brings about the importance of, designing a system whereby it protects people from financial hardships.
Thank you for sharing that. And maybe just sort of to conclude and to give you the last word, so to speak, is there any message you have?
I think very short is just that it's also based off my topic. It's just that healthcare cannot be considered truly free if households have to sacrifice their income, their food, or education, or even their assets to access it.